Hey there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this Facebook Live session. And this week we're talking about training older clients with hip osteoarthritis. Because if you work with older clients like we do here in our clinic, then you definitely work with clients that present with chronic tightness, maybe even discomfort, and an inability to do the things they need to, want to, and or love to do. So in this week's session, in conjunction with what we're teaching at the Integrative Movement System Specialist Certification Program, today we're talking about the hip. So we're going to share with you some of the strategies that we share with the live participants that come through our 5-day, actually it's a 6-month intensive program. So first of all, in today's session, I want to discuss why do so many of our clients have hip osteoarthritis? Because we hear things like, oh, it's genetics. It's because your mom had bad hips, so now you have bad hips. So I'm here to tell you, it's not because your mother had bad hips, or your uncle, or your father. Yes, there's a genetic component or a hereditary component to every disease process. We call it disease process. However, your lifestyle, your habits dictate far more what happens to your body than your genetics or your hereditary conditions, especially as it relates to this condition called hip osteoarthritis. So what is the process that leads to this thing that we call hip osteoarthritis? Well, first we have habits. We've all developed a set of habits around posture and movement. Maybe we've been taught something by our parents, like squeezing your butt or tucking your abs, pulling your abs in. Maybe you learned that habit because maybe you didn't like the way your stomach looked or your butt looked, so you started pulling to make yourself look thinner. Maybe you've had experienced injuries to your ankle, to your hip, to your low back, and now you've compensated around those injuries and you haven't moved away from those compensations. Maybe you've learned some exercise habits that are not optimal, and that's one of the things we really look at in our Integrative Movement Specialist Certification course is what are those habits you've learned around exercise that aren't always so great that can lead to these hip osteoarthritic conditions. So we have these issues based upon our habits that have been set up by what we've learned, what we've seen, what we've been taught. Injuries, surgeries, traumas all create and dictate our habits. So then what happens? Well, then these habits start to dictate what happens to the joints. And what happens to the joints is first we start getting soft tissue issues. So what are soft tissue issues around the hip? Well, we start to create cartilage degeneration. And oftentimes it's because the hip is getting pushed too far, either medially and or anteriorly and or superiorly in the acetabulum. So the femur, the femoral head, is going too far up into the socket, and now we start to create wear and tear on the cartilage surfaces. And we know from research that most cartilage degeneration happens around the superior and anterior surfaces of the hip, especially where it gets compressed medially and or forward in the acetabulum. We also are starting to see things in young girls now. We have 13-year-old girls coming to us. Yes, 13-year-old girls, they're coming to us with labral tears. They already have soft tissue changes around their hip because of these non-optimal habits. If you keep these non-optimal habits going for long enough and you keep these soft tissue injuries happening, then you start creating more bony formation. So now you start to move into the osseous changes. And again, even at 13 years of age, our clients, we have patients that are presenting to us with bony changes, osseous changes of their hip joint already. And now when our clients come to us as older adults with hip osteoarthritis, you can start to get an idea of why now the body's laying down more bone to protect against these osseous or these soft tissue injuries. Because of these habits, the bony changes are really just a compensation that your body creates to create more stability and control around that hip joint. So this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. We've just been discussing the reasons why your clients have hip osteoarthritis. Habits dictate what they do and how they move. They create soft tissue issues around their joints, and then they develop osseous changes, which then go back and change their habits, and it just becomes a self-perpetuating cycle. What we want to do as health and fitness professionals is attack this right here. Change their posture and movement habits that are leading to these issues, and if they already have issues, what can we do around their habits to create a more optimal strategy for them? So tomorrow I'm going to share with you a very quick and easy assessment you can do that we use with our own older clients here in our clinic. And then later in the week, we'll share with you some of the corrective exercise strategies we use, as well as some of the functional exercise progressions. Thanks for watching. We'll catch you tomorrow on Facebook Live at Fitness Education Seminars, which we're now changing the name to the Institute for Integrative Health and Fitness Education. Have a great day.